Welcome to the Masterclass on Mastering Routes of Drug Administration. This video will cover essential concepts to prepare you for competitive nursing exams. Let's start with our first question. Which route of administration provides the fastest onset of action in an emergency? The correct answer is C, intravenous. The IV route delivers medication directly into the systemic circulation, bypassing absorption barriers for an immediate onset of action. Next, which of the following routes avoids the first pass effect? The correct answer is B, sublingual route. This route allows drug absorption directly into systemic venous circulation through the oral mucosa, bypassing the hepatic first-pass metabolism. What is the correct angle of insertion for an intradermal ID injection? The correct answer is A, 15 degrees. Intradermal injections, often used for TB testing, are inserted at a shallow 5 to 15 degree angle to place the drug just beneath the epidermis. Which site is preferred for intramuscular IM injections in infants under 12 months? The correct answer is C, vastus lateralis. This muscle is the most developed and safest site in infants for IM injections, as it is free of major nerves and blood vessels. Bioavailability of a drug refers to which of the following? The correct answer is B. Bioavailability is the proportion of a drug that successfully enters the systemic circulation unchanged. IV administration achieves 100% bioavailability. The Z-track method is used for IM injections too. The correct answer is B. The Z-track method displaces the skin, preventing backflow of medication into the subcutaneous layer, which protects sensitive skin from irritation or staining. Which route is preferred for a patient who is vomiting uncontrollably and cannot take oral medications? The correct answer is B, rectal. The rectal route is an alternative for drug delivery when patients have persistent nausea or vomiting, cannot tolerate oral medications, or are NPO. What is the angle of insertion for a typical intramuscular IM injection? The correct answer is C, 90 degrees. IM injections require a 90-degree angle to penetrate deep into the muscle tissue, ensuring proper absorption of the medication. Intraosseous IO infusion is indicated when. The correct answer is B. IO access is a life-saving procedure to provide vascular access in emergencies when peripheral venous access cannot be obtained quickly. Which site is common for subcutaneous SC injections? The correct answer is B. The abdomen, avoiding the immediate periumbilical area, is a standard site for SC injections due to reliable fat distribution. Why are transdermal patches effective? The correct answer is B. Transdermal patches allow for a continuous, steady release of medication into the blood, suitable for long-term therapy. What is the angle of insertion for a subcutaneous injection? The correct answer is ASC injections are typically administered at a 45 to 90 degree angle, depending on needle length and patient fat content. Which route is strictly used for diagnostics and testing? The correct answer is B. Intradermal routes are primarily used for diagnostic tests such as PPD or allergy testing, rather than for a therapeutic systemic effect. The first pass effect primarily occurs in. The correct answer is B. The first pass effect occurs in the liver, where enzymes metabolize a significant portion of orally administered drugs before they reach systemic circulation. Which route is often termed, quote, parenteral? The correct answer is B. Parenteral refers to administration via routes other than the digestive tract, primarily injections like IV, IM, and SC. Let's test your knowledge on needle gauges. Which needle gauge is considered the smallest? The correct answer is C, 25G. In needle sizing, the gauge number is inversely proportional to the diameter, meaning a higher gauge number indicates a smaller needle. Moving on, which route uses inhalers or nebulizers to deliver medication? The correct answer is B, inhalation. This route delivers drugs directly to the airways for local or systemic effects, such as with medications like albuterol. What is the key advantage of using a depot preparation in intramuscular injections? The correct answer is B. Depot preparations provide a sustained release of medication over time, allowing for less frequent dosing by slowly absorbing from the muscle. Which factor influences the absorption speed of an IM injection? The correct answer is D, all of the above. Absorption speed depends on the muscle's vascularity, the viscosity of the solution, and the level of muscle activity at the injection site. What is considered a major disadvantage of the intravenous IV route of administration? The correct answer is C. The IV route is irreversible once administered, and breaking the skin barrier increases the risk of infection, such as phlebitis or sepsis. How should a nurse prepare the skin site before giving an injection? The correct answer is B. Cleaning with alcohol in a circular motion from inner to outer helps remove surface bacteria and prevents pushing them into the puncture site. How does the use of transdermal patches relate to avoiding the first-pass metabolism? The correct answer is A. Transdermal drugs enter the systemic circulation via skin capillaries, completely bypassing the hepatic portal system and first-pass metabolism.